Having talked with many parents about an ADHD diagnosis and the natural ways to help it, there is still a lot of confusion on if a child actually has ADHD. What are the causes of it? And how can we help them without medications? In this video today, we will look at ADHD through a completely different lens, and a different lens than just a diagnosis. We're going to unpack it to see the symptoms and then how the brain and the nervous system influence all of these systems of the body that ultimately bring about the attention, focus, and impulse control struggles. Now, going back to a main root cause will truly help make sense of all of this and help us find answers to address the difficulties. Now, if you are a parent who is looking for drug-free options, but all you hear from your child's teachers, school administrators, or counselors is that medication is the only or the best option. If this is not congruent with your beliefs, or if you want to hear about other options, this video is made specifically for you. Additionally, many people attribute ADHD symptoms as genetic. Maybe you struggle with this, so it makes sense that your child does too. Now, I am Dr. Megan, a neuro-focused pediatric chiropractor. Now, in this video today, we're going to explore what ADHD really is, how to properly test for it, and most importantly, how to address the root causes of ADHD struggles. You'll learn about our unique approach that goes beyond traditional diagnoses and medication. We offer a path to turn ADHD into a strength or a superpower. Now let's talk about some very eye-opening statistics. Recent data shows that ADHD affects about 6 million children in the United States alone. That's roughly 9.4% of all children. Even more striking, ADHD diagnoses increased by 42% between 2003 and 2011. These numbers are staggering, but what's truly concerning is that many of these children are prescribed medications as a first-line treatment without exploring the root causes or alternative approaches. Now, the good news is that at Statera Chiropractic, we're seeing a growing trend of parents seeking more comprehensive drug-free solutions for their children's ADHD symptoms. Now, first, it's very crucial to understand that ADHD is not a one-size-fits-all. There are different types, including the combined type, the hyperactive impulsive type, which we refer to as raging bull kiddos, and the inattentive type, or the drunken bull kiddo. Each presents differently and requires a tailored and customized approach to care. Now, ADHD isn't just a busy, overwhelmed brain. The body can be overwhelming the brain too, causing the entire central nervous system to be in fight or flight mode. Now, the question that most parents have is, where does this stress from the body come from? The quick answer is from 4 key stressors that are often overlooked. Number 1, high stress and high risk pregnancy. This puts mom and baby into a sympathetic dominant state that shifts more of them into a fight or flight protective state. 2 is birth intervention, such as forceps, vacuum extraction, C-section, or even induction places a physical component of stress on the body, most commonly in the upper neck and the shoulders, which overwhelms the neuromotor development. The third is fussy or colicky as an infant with reflux or constipation struggles that continue to overwhelm our body's autonomic nervous system. And fourth is frequent ear and or respiratory infections before the age of 3 years old, along with antibiotic use, further adding to the stress on the autonomic nervous system and the vagus nerve. Now, when the nervous system gets overtaxed and overworked with these 4 stressors, the signals it sends to the brain are full-on protection, fight or flight responses in every area of the brain. The cerebrum, which houses our motor centers, this can cause kids to not be able to sit still. The midbrain, this affects our focus and attention. And then our prefrontal cortex region, that affects a child's socialization and situational awareness and the ability for them to self-calm and regulate. Now, ADHD isn't just hyperactivity. An overwhelmed body and brain can cause brain fog and focus and attention issues, and if not addressed, can be a huge energy drain for our kids. This is actually quite common to see with ADHD, especially if the child has struggled with all four of those causes we talked about earlier, to be more wound up and tired out instead of hyperactive. Now, this happens for these main reasons. When the system is in a sympathetic dominant state for a long time, this leads to high energy, low sleep, constant stress, and it eventually burns out and demotivation, tiredness, and grumpiness sets in. So what is the role of genetics in ADHD? Yes, genetics can influence these behaviors, but not nearly as much as we think. The nervous system, vagus nerve, and its development play a much greater role. In studies by Dr. Bruce Lipton, a PhD biologist who studies specifically epigenetics, it is estimated that no more than 15% of our genetic code determines our outcomes. Now, this means that 85% is up to us and our environment, influenced specifically by our internal and our external environment. This is incredibly encouraging, meaning that though parents may struggle with attention, focus, etc., it doesn't mean that their kids have to too. So how can we test for ADHD? Traditional ADHD tests often focus solely on the symptoms. Here at Statera Chiropractic, we go deeper. Our INSiGHT Neurological Scans allow us to measure the exact amount of distress, dysfunction, and disorganization within the central and autonomic nervous system. This gives us a very clear picture of what's actually going on in the brain and in the body. For example, in a classic Raging Bull ADHD case, we might see a total energy index of over 350 or more, when the optimal is 150 or less. In an inattentive Drunken Bull type, we might observe a pattern score of 50, when 100 is ideal. These metrics tell us much more than a checklist of behaviors ever could. Instead of just addressing and trying to treat the symptoms, we focus on the underlying neurological imbalances. ADHD often stems from a very overstressed, stuck, and out of balance nervous system. By addressing this root cause, we can create lasting change. Now, using the data from our scans, we create a customized care plan tailored exactly to what your child needs, no one-size-fits-all plan. While medication will have its place, we believe in exploring drug-free options first. Our approach aims to optimize brain function very naturally, reducing and eliminating the need for this medication in many cases. Now, perhaps most importantly, we help to reframe ADHD. It's not just a disorder. It's a different way of processing information that, when properly managed, can lead to incredible creativity, productivity, and success in our children. If you are tired of feeling held back by ADHD, or if you are a parent watching your child struggle, it's time to take action. Don't let another day go by feeling overwhelmed or misunderstood. Please visit our website or give us a call to schedule your INSiGHT Neurological Scans, and let us work together to uncover the root causes of your ADHD symptoms and create a personalized plan to be able to use ADHD as a true superpower.